Question 1. The Certified Dietary Manager, CDM, is responsible for ensuring the final rinse temperature in a high-temperature dish machine reaches a minimum of what temperature to effectively sanitize dishes? A. 140 degrees Fahrenheit. B. 160 degrees Fahrenheit. C. 180 degrees Fahrenheit. D. 200 degrees Fahrenheit. Answer C. 180 degrees Fahrenheit. This question tests knowledge of high-temperature dish machine operation, a critical component of food service sanitation and safety. The key concept is that heat is used to kill pathogens on surfaces, and the keyword minimum emphasizes the required standard for thermal sanitization. To effectively sanitize dishware in a high-temperature machine, the final rinse cycle must reach a temperature of at least 180 degrees Fahrenheit at the dish surface to kill harmful microorganisms. For example, failing to reach this temperature means bacteria can survive on plates and cups, leading to potential illness among customers. Here's an easy way to remember. High-temp sanitation is a straight 180, a high standard for food safety. Question 2. Which type of menu provides a selection of food choices for each meal and changes over a set period of time, such as 14 or 28 days, before repeating? A. Static menu. B. A la carte menu. C. Cycle menu. D. Table d'hôte menu. Answer C. Cycle menu. The concept being tested here is menu types, specifically in institutional and healthcare settings, where the clue is a menu that changes over a set period of time, before repeating. A cycle menu is a carefully planned sequence of menus that is used in rotation for a specific period, typically 1 to 4 weeks, to ensure variety and help standardize purchasing and production. Using a cycle menu makes forecasting food needs and managing inventory much easier and allows staff to become highly efficient at preparing the same items regularly. For example, a hospital might use a 21-day cycle menu to keep residents from getting bored with the food while maintaining production consistency. Remember that a cycle menu simplifies long-term planning because you know exactly what will be served on any given day. Question 3. What is the most critical step a CDM must take immediately upon receiving a physician's diet order that appears incomplete or unclear? A. Call the nursing unit to confirm the patient's food preferences. B. Put the order on hold and only serve the patient a clear liquid diet. C. Contact the ordering physician or the patient's nurse for clarification. D. Document the missing information and assume the standard house diet. Answer C. Contact the ordering physician or the patient's nurse for clarification. This question tests the CDM's clinical judgment and communication protocol, focusing on the critical step when a diet order is incomplete or unclear. Patient safety is the highest priority, and a CDM must never guess or assume a diet order. The correct course is to seek immediate clarification from the licensed practitioner, such as the physician or nurse. Serving a diet based on an assumption could lead to a severe complication. For instance, if a regular diet is given to a patient who requires a puree or a restricted diet. Always remember that patient care protocols demand direct communication with the ordering team to verify all diet details before service begins. Question 4. In financial management, the acronym FIFO is a common method for inventory rotation and stands for what principle? A. Fast in, fast out. B. First in, first out. C. Finished inventory, fresh order. D. Food item, fixed output. Answer B. First in, first out. This question is centered on inventory control, a key part of financial and food quality management in the kitchen, with the acronym FIFO being the central clue. The first in, first out principle dictates that the food products that were received into inventory first should be used first to minimize spoilage and waste. Following this procedure ensures that older stock is consumed before its expiration date, preventing the financial loss associated with discarding outdated ingredients. For example, when stocking a dry storage shelf, the older canned goods are moved to the front, and the new ones are placed in the back. Always practice FIFO to maintain food quality and keep your inventory costs under control. Question 5. Which nutrient's primary role is to build and repair body tissues, support the immune system, and produce enzymes and hormones? A. Carbohydrates. B. Fats. C. Vitamins. D. Protein. Answer D. Protein. This concept focuses on the fundamental roles of macronutrients, with the keywords build and repair body tissues serving as the main functional clue. Protein is essential for virtually all structural and regulatory functions in the body, which includes muscle repair, tissue growth, and the creation of vital compounds like hormones. Without adequate protein, a patient's wounds may heal slowly, and their immune system may be compromised, which is particularly critical in clinical settings. Think of protein as the body's primary building material. It is necessary for constructing and maintaining all parts of the human body. Question 6. What is the correct action level for chlorine bleach sanitizing solution used on food contact surfaces in a commercial kitchen? A. 10 to 25 ppm. B. 50 to 100 ppm. C. 150 to 200 ppm. D. 250 to 300 ppm. Answer B. 50 to 100 ppm. The concept tested here is chemical sanitization, which is crucial for preventing the spread of foodborne illness in food service. The key is knowing the standard concentration range, or action level, required for chlorine to bleach to be an effective sanitizer on surfaces that touch food. A concentration of 50 to 100 parts per million ppm is generally effective when mixed with water at the proper temperature and contact time according to manufacturer and local health codes. Using a solution that is too weak will not kill pathogens, while a solution that is too strong can leave a chemical residue or damage equipment. Always test your sanitizing solution with chemical-specific test strips to ensure the concentration is within the correct 50 to 100 ppm range. Question 7. When calculating a patient's estimated caloric needs, which factor is most important for determining the correct basal energy expenditure? B. A. Food preferences. B. Current height and weight. C. Social history. D. Time since last meal. Answer B. Current height and weight. This question addresses the nutritional assessment process, specifically the core variables required for estimating a patient's basal energy expenditure, B, or basal metabolic rate, BMR. The BE calculation uses established formulas, such as the Harris-Benedict or Mifflin-ST-Gior equations, which fundamentally require a patient's current body size, their height, weight, age, and gender, to accurately estimate the energy burned at rest. Without an accurate height and weight, the initial caloric baseline will be incorrect, potentially leading to under- or overfeeding the patient, which compromises their nutritional status. Remember that body size is the key physical measurement that determines the baseline energy needs before factoring in activity or injury. Question 8. A facility uses a production schedule to list the quantity of food to be prepared and the necessary staff assignments. What is the primary purpose of this tool? A. To determine the cost of labor for the payroll budget. B. To train new employees on basic cooking techniques. C. To control and coordinate food production efficiently. D. To record the temperature of all foods held hot. Answer C. To control and coordinate food production efficiently. The concept here is the function of production tools in food service management, where the production schedule is the central item being analyzed for its purpose. The primary goal of a production schedule is to act as a roadmap for the kitchen team, detailing exactly what items to prepare, the correct quantity for the forecasted demand, and who is responsible for each task, thus ensuring smooth and efficient service delivery. Without a clear schedule, staff may prepare too much or too little food, leading to waste or shortages, and tasks may be duplicated or forgotten. Always use the production schedule as your daily guide for maximizing efficiency and minimizing errors in the kitchen. Question 9. In the Hazard Analysis and Critical Control Points (HACCP) system, what is the term for a point or procedure in a food process at which control can be applied and is essential to prevent, eliminate, or reduce a food safety hazard to an acceptable level? A. Control point, CP. B. Standard Operating Procedure, SOP. C. Critical Control Point, CCP. D. Corrective Action, CA. Answer C. Critical Control Point, CCP. This question tests understanding of the foundational terminology of the HACCP food safety management system, with the detailed definition provided describing a critical control point. A CCP is a specific, measurable step in the food production flow where a hazard absolutely must be controlled, such as cooking a chicken breast to the proper internal temperature. If control is lost at a CCP, the food item must be thrown out or corrected because the food safety risk is too high. For example, cooling a pot of soup must be done within a specific time frame. The point where the temperature is checked during cooling is a CCP. Here's an easy way to remember. A CCP is the specific point where you absolutely must have control to ensure the food is safe. Question 10. When a food service manager conducts a test tray audit, what is the primary factor being evaluated? A. The cost of ingredients used in the recipe. B. The efficiency of the dishwashing system. C. The quality, temperature, and appearance of the food is served to the patient. D. The speed at which the trayline staff can assemble the meal. Answer: C. The quality, temperature, and appearance of the food is served to the patient. This concept relates to quality control and assurance in patient tray service, and the term test tray suggests the actual simulation of the patient experience. The primary purpose of a test tray audit is for the manager to follow a tray from the tray line all the way to a designated spot to assess the final product as the patient would receive it, ensuring all standards are met. This direct evaluation ensures the food is hot or cold as appropriate, visually appealing, and matches the menu and diet order, preventing patient dissatisfaction and ensuring safety. A good example is ensuring the hot mashed potatoes remain hot and the ice cream remains frozen when they arrive at the bedside location. Always use a test tray to confirm that your established quality standards are being delivered to the customer. Question 11. What is the primary reason for a CDM to use a standardized recipe for all menu items? A. To increase the creativity of the cooks. B. To reduce the amount of inventory held in stock. C. To ensure consistent quality, portion size, and cost control. D. To meet specific dietary requirements for all patients. Answer: C. To ensure consistent quality, portion size, and cost control. This question addresses the core management function of standardized recipes, a fundamental tool in food production. The main benefit of using a recipe that has been tested and approved is that it provides a specific procedure, ingredient list, and yield, which guarantees the product will be the same every time it is made, regardless of who is cooking. Consistent output directly leads to precise portion control and accurate food cost calculations, which are vital for budget management. For example, if every cook uses the same standardized recipe for chicken soup, the flavor, texture, and per serving cost will remain stable across all batches. Remember that a standardized recipe equals consistent product, consistent portions, and consistent costs. Question 12. A patient whose physician has ordered a 2-gram sodium-restricted diet should avoid which of the following foods? A. Fresh fruits and vegetables. B. Processed lunch meats and canned soups. C. Whole grain bread and pasta. D. Unsalted nuts and seeds. Answer: B. Processed lunch meats and canned soups. This concept tests practical knowledge of therapeutic diets, specifically the 2-gram sodium restriction, which is a common modification. Processed and prepackaged foods are the primary clue, as they typically contain high levels of added sodium for preservation and flavor. Foods like processed lunch meats, sausages, canned soups, and frozen dinners must be avoided or limited, because they can easily push a patient over the 2,000 milligram or 2-gram daily sodium allowance. Counsel patients to choose fresh, unprocessed foods, like fresh fruits and vegetables, which are naturally low in sodium. Encourage patients to focus on eating whole, unprocessed ingredients to stay within their sodium limit. Question 13. Which leadership style is characterized by the leader making decisions alone and then communicating the decision to the staff without seeking their input? A. Democratic. B. Participative. C. Autocratic. D. Laissez-faire. Answer: C. Autocratic. This question focuses on management and leadership styles, which is important for understanding how a CDM interacts with the team. An autocratic leader is characterized by holding all decision-making power and authority, relying on one-way communication to tell employees exactly what to do. This style can be effective in emergency situations or when quick decisions are required, but it often leads to low staff morale and limited input on routine operations. For example, a manager making a last-minute menu change due to a delivery error without consulting the cooks is acting autocratically. Here's an easy way to remember it. An autocratic leader acts as the sole authority and makes decisions alone. Question 14. What is the appropriate initial action for an employee who has cut their finger and is bleeding while working in the food preparation area? A. Finish the task quickly, then wash the wound and return to work. B. Immediately cover the wound with a bandage and a single-use glove. C. Stop working, discard any potentially contaminated food, and clean and cover the wound. D. Ask a coworker to take over the task and continue directing them. Answer C. Stop working, discard any potentially contaminated food, and clean and cover the wound. This concept addresses emergency food safety procedures and personal hygiene in the kitchen, a critical element of preventing food contamination. The correct procedure demands that the employee immediately stop working to prioritize safety, discard any food that may have been exposed to blood or the injury, and then properly treat and cover the wound before resuming any tasks. The flow of stopping work and discarding food is vital because blood and open wounds are a direct source of pathogens that can cause foodborne illness. Never assume the food is safe. The first action must always be to secure the food supply and address the wound. Question 15. The operating budget in a food service department primarily focuses on estimating and controlling which types of costs? A. Costs related to equipment purchase and building renovations. B. Costs associated with daily activities like food, supplies, and labor. C. Costs that include the long-term interest paid on loans and debt. D. Costs that cover only the salaries of the management team. Answer B. Costs associated with daily activities like food, supplies, and labor. This question tests a basic financial management concept, specifically distinguishing the core components of the operating budget. This budget estimates the revenue and expenses for the facility's routine, day-to-day operations, including the variable costs of food and supplies as well as the fixed costs of labor. Costs related to major assets like equipment and buildings are typically covered by a separate capital budget. For instance, the money spent on lettuce, hourly cook wages, and dish soap all fall under the operating budget. Always remember that the operating budget covers the costs of keeping the doors open and serving meals every day. Question 16. What is the most reliable way to monitor the effectiveness of a facility's in-service training program on proper hand-washing techniques? A. Ask employees if they feel confident about the procedure. B. Administer a written test about the hand-washing steps. C. Observe and document employees' actual hand-washing performance. D. Post reminders in the bathroom and production area. Answer C. Observe and document employees' actual hand-washing performance. This concept relates to personnel management and quality assurance in training, focusing on the most reliable way to monitor the effectiveness of a skill-based training. While written tests check knowledge, only direct, documented observation of an employee performing the skill, in this case, hand-washing, verifies that the training has successfully translated into the correct practical behavior. Simply posting signs or asking if they understand does not confirm they are doing the action correctly and consistently in a real-world setting. For example, a manager might use a checklist to watch cooks wash their hands before starting food prep and after handling raw meat. To truly ensure compliance, observation and documentation are always the best methods for tracking skill mastery. Question 17. The primary goal of a nutritional screening upon a patient's admission is to identify which individuals: A. Those who require immediate discharge planning. B. Those at nutritional risk who need a comprehensive assessment by a registered dietitian, RD. C. Those who are satisfied with the current menu options. D. Those who need instruction on how to use assistive eating devices. Answer B. Those at nutritional risk who need a comprehensive assessment by a registered dietitian, RD. This question explores the purpose of the initial clinical step, the nutritional screening, which is a mandatory part of the patient care process. The primary function of the screening is to quickly determine, using simple criteria like weight loss, diet history, and diagnosis, which patients are at high risk for malnutrition or other nutrition-related problems. Patients flagged as high risk are then referred for a full, in-depth nutritional assessment by the RD. Screening is not a treatment or a detailed assessment itself, but rather a quick triage tool to ensure that necessary professional care is provided to the most vulnerable patients. Always view the screening as the first line of defense to catch patients who need immediate attention. Question 18. What is the acceptable maximum time that potentially hazardous food, PHF/time, temperature control for safety, TCS, food can be held in the temperature danger zone? A. 1 hour. B. 2 hours. C. 3 hours. D. 4 hours. Answer D. 4 hours. This concept focuses on a fundamental role of food safety, specifically the cumulative time limit for keeping PHF/TCS food in the temperature danger zone, 41 degrees F to 135 degrees Fahrenheit. This standard rule states that after 4 cumulative hours in this temperature range, the food must be discarded because the rapid growth of pathogenic bacteria makes it unsafe to consume. For instance, if a pan of cooked rice is left out on a counter for 3 hours during preparation, it can only be safely held for 1 more hour before it must be either brought to the proper hot or cold holding temperature or thrown away. Always remember the 4-hour rule is the definitive discard limit for food that has been improperly temperature controlled. Question 19. A patient is observed pushing food around the plate, cutting food into very small pieces, and eating slowly. These observations suggest the need for further assessment for which condition? A. Severe dehydration. B. Difficulty swallowing, dysphagia. C. A 2-gram sodium diet restriction. D. An unknown food allergy. Answer B. Difficulty swallowing, dysphagia. This question tests the CDM's clinical observation skills, as the described behaviors, food manipulation, small bites, and slow eating, are strong clues often associated with dysphagia or difficulty swallowing. Patients who are concerned about choking often modify their eating habits to make the food safer to swallow, such as cutting it into tiny pieces or avoiding difficult textures. If a CDM notices these signs, it necessitates a referral for a formal swallowing evaluation by a speech-language pathologist. Recognizing these eating behaviors is critical because unmanaged dysphagia can lead to aspiration pneumonia and severe choking. Remember that changes in a patient's normal eating style often signal an underlying physical problem. Question 20. Which document provides detailed instructions for a medical emergency, a fire, or a chemical spill and must be immediately accessible to all food service employees? A. Material Safety Data Sheet, MSDS/Safety Data Sheet, SDS. B. Standard Operating Procedure, SOP. C. Production Schedule. D. Employee Handbook. Answer A. Material Safety Data Sheet, MSDS/Safety Data Sheet, SDS. This question concerns safety and regulatory compliance in the workplace, and the detailed content clues, including chemical spill, point directly to the function of a Material Safety Data Sheet, now commonly called a Safety Data Sheet, SDS. The SDS is a required document that provides comprehensive information about a hazardous substance, including instructions for safe handling, physical and chemical properties, emergency control measures, and first aid procedures. Employees must know where to find and how to use the SDS binder, which holds critical information for dealing with accidents like a concentrated chemical spill. Always ensure the SDS binder is current and easily accessible to all staff who work with cleaning and chemical agents. Question 21. When a CDM reviews the budget, which of the following is an example of a fixed cost? A. The monthly cost of food purchases. B. The expense of paper goods and disposables. C. The annual salary of the registered dietitian, RD. D. The hourly wage paid to part-time cooks. Answer C. The annual salary of the registered dietitian, RD. The This question tests financial management vocabulary, specifically the definition of a fixed cost within a departmental budget. Fixed costs are expenses that do not change significantly with the volume of meals served or the level of business activity over a specific period. Salaries for full-time, salaried employees like the RD are an excellent example, unlike variable costs, such as the amount spent on food or hourly wages, which fluctuate with demand. Whether the kitchen serves 50 or 150 meals, the RD's annual salary remains the same. Here's an easy way to remember it. Fixed costs are stuck and do not fluctuate with production volume. Question 22. Which of the following is the most effective approach for a CDM to use when giving an employee constructive feedback on a performance issue? A. Document the issue and immediately initiate a formal disciplinary process. B. Focus on the employee's personal flaws and weaknesses. C. Be specific about the behavior, explain the impact, and suggest a plan for improvement. D. Discuss the issue only in a group setting to save time. Answer C. Be specific about the behavior, explain the impact, and suggest a plan for improvement. This question covers effective personnel management and the proper process for providing constructive criticism, a key skill for a CDM. Effective feedback must be specific to the observable work behavior, not the person, and include a clear explanation of how the behavior affects the operation and what steps the employee must take to correct it. Delivering feedback privately and professionally, such as by telling a cook, "You missed checking the temperature on the casserole, which creates a safety risk. Please set a timer next time," helps the employee focus on fixing the process. Always focus constructive criticism on the work-related behavior and the necessary correction, never on the employee's character. Question 23. A prime vendor agreement in purchasing is beneficial primarily because it allows a food service operation to A. Purchase only the highest cost, most exclusive ingredients. B. Have a single source for most goods, potentially leading to better prices and streamlined ordering. C. Avoid writing any formal purchasing specifications for products. D. Only order products that are already in stock at the facility. Answer B. Have a single source for most goods, potentially leading to better prices and streamlined ordering. This concept relates to purchasing and vendor management, with the keyword prime vendor suggesting a centralized relationship. A prime vendor agreement is a contract with a single supplier to provide the majority of the operation's food and supplies, which can offer greater purchasing power, resulting in lower volume pricing and highly efficient, one-stop-shop ordering and delivery. Although using a prime vendor simplifies the process, the CDM must still write clear specifications to ensure quality standards are met. Utilizing a prime vendor helps simplify and centralize purchasing, saving time and potentially money by consolidating the facility's orders. Question 24. A resident is ordered to be NPO, nil per OS. What is the correct interpretation of this diet order? A. The resident should be given a clear liquid diet only. B. The resident can have pureed foods and thickened liquids. C. The resident should receive nothing by mouth. D. The resident must follow a strictly low-fat diet. Answer C. The resident should receive nothing by mouth. This question tests knowledge of essential medical abbreviations and clinical diet terminology, with the abbreviation NPO being the key clue. NPO is a Latin abbreviation for nil per os, which directly translates to nothing by mouth, meaning the patient is prohibited from receiving any food, liquid, medication, or anything else orally. This order is typically used before surgery, for certain medical tests, or in cases of severe swallowing difficulty. It is critical for the food service staff to strictly adhere to this order and avoid offering anything, even water, to the patient. Always treat an NPO order with the highest priority, ensuring absolutely nothing is given orally. Question 25. What is the most common cause of cross-contamination in the kitchen, leading to foodborne illness? A. Improper storage of cleaning chemicals. B. Failure to calibrate oven temperatures. C. Transfer of pathogens from raw foods to ready-to-eat foods via hands or equipment. D. Serving food slightly past its expiration date. Answer C. Transfer of pathogens from raw foods to ready-to-eat foods via hands or equipment. This concept addresses food safety and sanitation, specifically identifying the most common mechanism of cross-contamination, which is a major pathway for foodborne disease. This occurs when bacteria and pathogens from raw meat, poultry, or seafood are transferred to foods that are served without further cooking, such as salad, by an unwashed cutting board, a soiled towel, or unwashed hands. For example, slicing tomatoes on the same cutting board just used for raw chicken without sanitizing it in between is a classic example of cross-contamination. Always remember that the most effective way to prevent this transfer is by washing hands, equipment, and cutting boards between every task. Question 26. A patient who is experiencing significant weight loss, poor skin turgor, and concentrated urine is most likely suffering from which nutritional issue? A. Protein-calorie malnutrition. B. Iron deficiency anemia. C. Dehydration. D. Vitamin C deficiency. Answer C. Dehydration. This question tests the CDM's ability to identify the clinical signs of common nutritional issues, with the signs poor skin turgor, skin slowly returns to normal after being pinchety, and concentrated urine being classic indicators of dehydration. Dehydration occurs when the body loses more fluid than it takes in, which is a serious concern, especially in elderly and frail patients. Addressing these signs requires increasing fluid intake immediately, which the CDM can coordinate with the nursing staff. Recognizing these specific physical clues is vital because dehydration is a rapid, life-threatening condition that can quickly worsen a patient's health. Question 27. When forecasting food needs for a cycle menu, which factor is most crucial for the CDM to consider to ensure accurate production amounts? A. The historical production records of the same menu cycle. B. The personal favorite recipes of the head cook. C. The market price fluctuations of the ingredients. D. The total number of full-time employees on staff. Answer A. The historical production records of the same menu cycle. This concept focuses on the core management function of production forecasting, where accuracy in determining how much food to prepare is the main objective. The most reliable data for future production is the documented historical records from the last time that exact menu cycle was used, as this reflects actual patient demand and popularity. This historical data, such as records of leftovers or shortages, helps the CDM make necessary adjustments to the amount to be prepared, thus controlling both food waste and potential shortages. Always use past production data as the primary predictor of future demand for cycle menu items. Question 28. What is the key advantage of a selective menu over a non-selective menu in a healthcare setting? A. It simplifies the procurement process for the purchasing manager. B. It requires less time for patients to make a choice. C. It can lead to decreased food waste and increased patient satisfaction. D. It reduces the required number of food service personnel. Answer C. It can lead to decreased food waste and increased patient satisfaction. This question tests knowledge of menu service styles, specifically the benefit of a selective menu, which offers patients a choice from a list of options. Giving patients a choice allows them to select foods they actually want to eat, which in turn leads to higher food intake, less food being thrown away, and an overall better perception of the quality of care. The positive impact on waste reduction and customer experience far outweighs the slightly increased complexity of the ordering and tray assembly process. For example, letting a patient choose between baked chicken and meatloaf ensures they receive a meal they are more likely to fully consume. Remember that choice equals satisfaction and less waste in food service. Question 29. A Certified Dietary Manager, CDM, is budgeting for the year. The expense for purchasing a new commercial-grade freezer would be categorized under which budget type? A. Operating budget. B. Capital budget. C. Labor budget. D. Revenue budget. Answer B. Capital budget. This concept differentiates between budget types, where the purchase of a major, long-lasting asset like a new commercial-grade freezer is the key clue. The capital budget is reserved for costly, long-term investments, often referred to as fixed assets, such as major equipment purchases, building renovations, and vehicle acquisitions, which are intended to last for several years. These expenses are distinct from the daily costs covered by the operating budget, such as food and supplies. For example, any purchase above a facility set threshold, like $5,000 for a new piece of equipment, would typically be categorized in the capital budget. Always categorize expensive, long-lasting items as part of the capital budget. Question 30. For a patient with chronic kidney disease, renal diet, which nutrient is often severely restricted to prevent the buildup of toxins and fluid retention? A. Vitamin C. B. Fiber. C. Protein. D. Simple carbohydrates. Answer C. Protein. This concept addresses the complex nutrient modifications required for a renal kidney disease diet, where the keyword is restricted to prevent toxin buildup. In chronic kidney disease, the kidneys struggle to filter the waste products from protein metabolism, leading to a buildup of toxins like urea in the blood. Therefore, protein intake is often carefully limited and controlled by a healthcare professional to reduce the workload on the failing kidneys. For example, a patient may need to limit portions of meat, eggs, and dairy to manage their protein load. The restriction of protein is a cornerstone of managing the nutritional needs of patients with advanced kidney disease. Question 31. What is the proper procedure for safely cooling a large pot of chili after it has been cooked? A. Place the covered pot in the refrigerator immediately. B. Leave the pot uncovered on the counter until it reaches room temperature. C. Divide the chili into shallow pans and cool it rapidly in an ice water bath or chilling unit. D. Store the chili in an insulated hot holding unit overnight. Answer C. Divide the chili into shallow pans and cool it rapidly in an ice water bath or chilling unit. This question addresses the critical food safety step of cooling, which is a critical control point, CCP, for preventing pathogen growth. To move food quickly through the temperature danger zone, it must be rapidly chilled, which requires increasing the surface area by dividing it into shallow containers and using a fast cooling method, such as an ice bath. Placing a large hot pot directly into the refrigerator traps the heat, causing the center to cool too slowly, allowing bacteria to multiply to dangerous levels. Always remember that rapid cooling is achieved by reducing volume and using an external chilling method to pass through the danger zone quickly. Question 32. In the absence of a registered dietitian, the CDM is asked to complete a comprehensive nutrition assessment. What is the most critical component that the CDM, by professional scope, is not authorized to complete? A. Obtaining the patient's height and weight measurements. B. Documenting the patient's food preferences and allergies. C. Developing and implementing the specific individualized nutritional care plan. D. Calculating the patient's percentage of weight change over time. Answer C. Developing and implementing the specific individualized nutritional care plan. This concept clarifies the crucial professional boundary and scope of practice between a CDM and an RD, with the phrase, "not authorized," being the important constraint. While the CDM can collect assessment data like weight, height, and preferences, the development and formal implementation of a highly specialized, individualized nutrition care plan, especially for complex conditions, is a function reserved for the licensed RD. The CDM's role is to support the plan through menu management and execution, not to create the clinical interventions themselves. Remember that clinical diagnosis and the design of the individual care plan are always the responsibility of the RD or other licensed clinical professionals. Question 33. The CDM notices a consistent pattern of high customer complaints about the cleanliness of the dining room tables. Which quality management tool should the manager implement first to track and analyze this problem? A. A perpetual inventory system. B. A corrective action report, SAR. C. A customer satisfaction survey. D. A checklist or auditing tool for table sanitation. Answer D. A checklist or auditing tool for table sanitation. This question tests the application of quality management tools to solve an operational problem, with the clue being the need to track and analyze a consistent problem. The most effective first step is to create a simple, standardized checklist or auditing tool to define, measure, and monitor the required cleaning steps to ensure consistency and identify where the process is failing. While a survey identifies the problem, the checklist helps to correct and monitor the process itself. For example, the checklist would require staff to confirm they are using the correct cleaning solution and wiping down every table surface after use. Always start with a simple checklist to standardize the process and identify the specific point of failure. Question 34. What is the purpose of a tally sheet in food production? A. To record employee shift hours for payroll calculation. B. To document the specific cost per serving for each menu item. C. To record the number of portions of a specific menu item requested and served. D. To track the amount of food received from the primary vendor. Answer: C. To record the number of portions of a specific menu item requested and served. This concept focuses on production records, where the tally sheet is a simple, effective tool for tracking actual customer demand for menu items. The primary use of a tally sheet is for the tray line or service staff to record the total count of each dish that is requested, which is vital data for forecasting future production needs and adjusting the next menu cycle. This record helps to ensure that the production kitchen makes the correct amount, reducing the likelihood of running out of popular items or having excessive leftovers. Use the tally sheet data to fine-tune your production schedule so you're always meeting customer demand accurately. Question 35. Which nonverbal communication cue from a patient during a menu interview would suggest the CDM needs to use a simpler or alternative communication method? A. Maintaining consistent eye contact and nodding politely. B. Looking confused, avoiding eye contact, or shrugging shoulders repeatedly. C. Enthusiastically pointing to menu options. D. Holding the menu and pointing out the items they previously enjoyed. Answer: B. Looking confused, avoiding eye contact, or shrugging shoulders repeatedly. This question tests the CDM's ability to interpret nonverbal communication in a clinical setting, with the key clue being the need to identify signs that suggest a patient is struggling to understand. Nonverbal cues like confusion, avoidance, or excessive shrugging strongly indicate that the patient is having difficulty processing the information, which requires the CDM to switch to a different technique, such as using simpler language or visual aids. If a patient is exhibiting signs of confusion, continuing with the current method risks getting an inaccurate order or causing the patient distress. Always observe nonverbal cues and be prepared to modify your communication style to match the patient's comprehension level.